Okay, so I'm gonna get started because we're on a limited time and I wanna make sure that you guys also have time to experience other presentations. Um, my name is Stephanie and I am a high school senior at Kepner High School. And this is my project. It's titled Case Report COVID-19 Induced Schizophrenia. My mentor was Dr. Jontel Pierce, and I mentored under the Mind Neurology Clinic. Its logo is located at the top left. So the main theme of my project was about a 55-year-old Hispanic male who suffered from an unusual manifestation of the COVID-19 virus. Usually we think of COVID-19 as primarily a respiratory disease, but he developed neurological symptoms. So that was very unusual for the diagnosis that he was given. And that definitely piqued my interest and made me want to study his case. And in studying his case, I hope to promote the effect that COVID-19 has on the neuropsychiatric balance. And I also want to create special room to create more precaution on exactly how COVID-19 affects your neurological symptom. And I want to make sure that we increase its overall awareness to make sure that, we can avoid his case in future cases. So how does coronavirus actually enter the nervous system? Well, we have like four primary openings to the human body and its immune system. Those are the eyes, the nose, the mouth, and the ears. And so normally, or at least how the coronavirus enters into the brain is through the nose. So imagine somebody sneezes on you and those droplets land close to your nose. The coronavirus, which is a single RNA virus, will travel from the nose all the way to the olfactory bulb. That is a structure located towards the back of your nose. And that structure is centered around some mucosa and some nerve endings. So from there, the coronavirus can enter into your neurons and ride its way all the way into the brain. So it goes from the nose to the olfactory bulb all the way to your nervous system. So, based on a study by China, Hong Kong, and other various countries that were principally affected by COVID 19, about 65% of severe COVID 19 patients experienced bouts of delirium, and about 21% experienced states of altered consciousness. I included this statistic to show that COVID 19 does have a established correlation to the neurological balance and mental disorder, which is kind of the process that happened to the patient in this case report. So I wanted to make sure that I established the link. So the patient in this case report suffered from schizophrenia. But what is schizophrenia? Schizophrenia is a severe mental illness that causes functional impairment. It is a chronic disorder that changes somebody's way of life, and it's definitely something that needs to be managed and treated with therapy and medication. And this is according to the National Psychiatric Institute. So it's definitely not a disorder that can be taken lightly. Now, the case. The case was centered around a Hispanic male who was 55 years old. Take note of his age because that is an important detail later. So the patient visited the Methodist Hospital around the beginning of January. And in his Methodist Hospital visit, he was diagnosed with AMS secondary to acute toxic encephalopathy. AMS stands for altered mental status, and it's basically a term used for patients that are suffering from confusion or delirium. And acute toxic encephalopathy is a umbrella term used to describe those that are suffering from confusion but do not have an underlying brain disease that is accounting for it. So it's used to describe basically the spontaneity of the delirium that he was suffering from. And already physicians were suspecting that he was suffering from schizoaffective disorder, even towards the beginning of his medical journey. He was diagnosed with COVID-19 pneumonia, which was both afebrile and hypoxic. Afebrile meaning that he did not have a fever while suffering from the pneumonia, but hypoxic means that he was suffering from a loss of oxygen. So he was not getting oxygen all throughout his body like it should have been. His chest CT showed bilateral mild patchy interstitial and ground infiltrates. Located to the right on this picture, it shows the opacities on the lungs that are generally not supposed to be there. That shows that oxygen is being obstructed from where it needs to go, and that is very bad. So it showed that his COVID-19 was a pretty severe manifestation than, the normal or the more less severe presentation of the disease. So his head CT showed no overt signs or symptoms. So basically his scans came out clear, and there was no reason to cause any type of alarm based on his scans at that time. He was given some COVID-19 medications like a albuterol inhaler, Zithromax, and hydroxychloroquine, which were all used to treat his initial diagnosis of COVID-19. And he was given schizophrenic medications, which were used to treat his hallucinations and his delirium. That was called Seroquel. So about a week later, he was referred to the Mind Neurology Clinic for his neurological symptoms. That's where Dr. Pierce first encountered his case. Overall, he was evaluated for a pretty healthy physical exam. And what caused alarm was his abnormal psych exam. He experienced new mood changes, aggression, hallucinations, loss of memory, which were not typical to his patient history, which showed no type of neurological symptoms. And he was also given a mini cognitive test. This test was used to basically gauge his cognition and the way his brain was functioning at the time. He scored a 1 out of 5, which was pretty low for a person of his age, and that implied likely cognitive impairment. And so he was given medical orders of an MRI and EEG. The MRI was used to diagnose whether he had any type of clot or he was suffering from a stroke at the time. And the EEG was used to evaluate whether he was suffering from a seizure. He was also continued on his schizophrenic medications, which was the Seroquel that he was prescribed earlier. When he visited the Simon Med imaging facility, he was given a negative MRI without contrast, again to test whether he was suffering from a stroke. Basically, his scans came out unremarkable. He had no type of infarction, hemorrhage, mass lesion, or acute intracranial abnormality. His scans were clear. So that was surprising, and that was not what Dr. Pierce was expecting. His substructures were also analyzed, and that showed no statistically significant volume loss. So he was not suffering from any sort of degenerative neurological disease like Alzheimer's, for example. And that, continued to baffle Dr. Pierce and a lot of his other physicians that were looking after him. He visited the Mind Neurology Clinic again for his EEG. And again, his results showed no type of abnormality. So that was, again, very shocking. He had a posterior dominant rhythm with an average background of 10 to 11 hertz. That was pretty normal for a man of his age. And he was showing no signs of any type of seizure or epileptic discharges. His mental state, however, was worsening because he was avoiding taking his Seroquel prescription, which worsened his hallucinations and his delirium. And he was experiencing bouts of confusion, irritability, and visual hallucinations at night of people who had passed away. He was becoming more and more easily aggravated, and he was sundowning, that's a term used to describe those that experience more confusion and hallucinations when the sun sets. It's a phenomenon experienced by those with neurological disorders. So Dr. Pierce at that time decided to basically prescribe him a kind of umbrella combination of medications. He was given Eliquis to prevent any type of clotting that may have not been discovered within his scans and to minimize any type of clotting within his brain. The hydroxychloroquine and the hydroxyzine were used to treat his underlying COVID-19 symptoms that may have still been lingering. And the Seroquel, the magnesium oxide, and the vitamin B were prescribed to better his mental health and decrease his anxiety. So about maybe 3 to 4 weeks later, he visited the Mind Neurology Clinic for about the last time. His final experiences were that he was forgetting things that he had previously known how to do, which was very unfortunate. He used to be a contractor, and he used to be able to build things with his hands, and he was unable to do that. He was unable to drive or work, and he was in his daughter's care. Dr. Pierce had prescribed him an autoimmune panel, and that panel came back normal. So again, any type of diagnoses that was not pertaining to COVID-19 was being ruled out through Dr. Pierce's diagnostic tests. He was canceled on the following medications: the Eliquis, the hydroxychloroquine, and the hydroxyzine. So he was stopped on his clotting medication and his COVID-19 medications because basically those were ruled out and he was okay to be stopped on those. So surprisingly and thankfully, based on his events after his visit to my neurology clinic, he was continued on the Seroquel, as mentioned before, and thankfully he returned to baseline function. So he was able to, his hallucinations and his confusion was minimized, and he was able to return to work and stop his medications. So really great that he's doing very well and he's still in the care of his daughter. So you may be wondering, how did he return back to his baseline function ability? And basically, I would say that based on my final interpretations, I would say that the COVID-19 virus is probably the principal cause of his schizoaffective disorder because, again, all of his diagnostic tests ruled out any sort of immune disorders or any type of coagulation within his brain. Seizures were also ruled out. So any type of neurological diagnoses that he could have been given other than this COVID-19 virus were canceled out of his diagnostic tests. I ruled that the original COVID-19 virus infection probably caused a cytokine inflammatory response within the patient's body. Cytokines are basically your body's defense when it encounters any type of infection or virus, any type of invader that is deemed foreign within the body. A lot of times when you are in healthy individual like the patient at hand, your body can overcompensate and it can overproduce these cytokines, and which is not very good. Cytokines, when they are overproduced within the body, they can cause a destruction in tissue and cause some type of inflammation within the body. So especially if COVID-19 entered into the brain without anybody knowing, it could have caused some inflammation that caused his psychiatric disorder. So this left the patient in a state of delirium. Cytokine release syndrome is known to cause neurological symptoms, especially within older patients, like the patient within this case report, and many different studies within the National Institute of Health and other reputable research sites have stated that this cytokine release syndrome has been known to cause a type of disarray within the psychiatric balance. And usually the cytokine release syndrome is generally fatal and it can cause mortality, especially when it is on its most severe within the spectrum. But thankfully, the patient probably went through one of its most mild of occurrences, and he was able to recover to his baseline function. So discussion, how does this case report affect the world? So I'd like to highlight that the case report emphasizes the pros and as well as the limitations of private care that Dr. Pierce runs within her private practice. The private practice facility has both pros and cons. The pro would be that it causes more attentive care within the patient because it's within a relatively small space. The doctor at hand can afford to spend more time and spend more care within diagnosing the patient and providing any type of help or aid within their needs. One of the cons, though, is that there is a presence of extraneous variables due to the lack of full resources within the private practice. Like I said before, the patient had to venture outside the private practice in order to get his MRI, which was a limitation by the private practice. And the private practice only had an EEG on site. So because of that, because you are switching care from one physician to another and changing the type of personnel within the facility, you can introduce some variables within the case that may have not been there otherwise. But overall, I do think that the private practice facility benefited the patient because he required such very careful care within the medical facility. So I definitely think it was a pro for him rather than a con. Um, this disparity within hospitals can be combated, though, by smaller patient to doctor ratios within hospitals. Especially now within COVID, we've seen that doctors and ICUs were overloaded with so many patients, and there was just not enough medical personnel to go around. So I would suggest that we lower the ratios as possible in order to help patients that do not have access to private care facilities gain more care and attention. And then I also wanted to highlight that this case overall promotes attention to brain health for underrepresented groups, especially because the case report focused on Hispanic male. It draws attention to the health disparity within minorities as they go through the medical field. Um, there's just different specifications for different races that should not necessarily be there, and that can cause a disparity within their overall treatment. So definitely we need to look into that and raise more caution on how we care for those that may not be overrepresented within the medical facility. And I also want to acknowledge that neurological balance and wellness needs to be acknowledged within all groups within the world. And we need to create more awareness and more acceptance over psychiatric disorders. We need to remove the taboo on mental health and make sure that we are all okay mentally and physically. So that's it for my case report. I thank you all for tuning in and listening. And that's it. So thank you. Does anybody have any questions for me? And I will stop sharing in a minute. Thank you for the applause. Now, if you are willing and able, you can visit other breakout rooms. But thank you for coming to mine, and thank you for listening. I will restart my presentation in about, let's see, 2 more minutes if there's not any more questions.